With me today is Dr. Sakid Gundapalli. Sir has traveled all the way from Colorado. He had a talk on cancer screening. Sir is working at the University of Colorado. So, sir, you have spoken about a very good topic, sir, cancer screening, sir. So, can you briefly discuss about this topic, sir?
So when we talk about cancer screening, one of the things that we're looking at is how can we detect cancer early before it is spread all over the body. That's basically what we're doing with cancer screening. So we have some tests for certain gynecologic cancers that we know decrease the incidence of that cancer because we catch the cancer very early before it has a chance to spread all over the body.
Absolutely.
So one is cervical cancer. So with that we have the Pap test. So we recommend the Pap smear or Pap test for women of a certain age group when they're very young, so that we can catch the cancers before they spread all over the body, before they become invasive and can cause harm. So that's one thing. Mammogram for breast cancer is another thing that, as we know, the incidence is increasing in India, and we want to make sure that it's caught early.
So we commonly in India do the Papanuclear smear, what you rightly mentioned, sir. Sir, who are the women who you think should be targeted? Is it all the age groups? Any particular age group you want to target when we speak about CA cervix or CA breast?
Sure. So for CA cervix, we recommend generally in the US, the recommendations are to initiate screening at age 21. So we do the Pap test. We don't do the HPV test in very young women because we know that most women will be HPV positive and most women will clear the virus that causes the cancer. In some women, they won't. So we want to catch the women that don't. So we recommend the Pap test every 3 years between age 21 and age 29. If that's all normal between age 30 and 65, we say every 5 years is fine. After age 65, if there's no abnormal Pap smears, they don't need any more screening at that point. If it is abnormal, there are certain guidelines that we say they should get a colposcopy, they should be triaged for more invasive tests. But generally, those are the guidelines for CA cervix.
So what is your advice, sir? What we have to do with the results per se, sir?
Sure. So there are clear guidelines. So if it's a high-grade lesion or something that is very abnormal, they should go for colposcopy. If it's not so abnormal, you can repeat the test. You can test for HPV, looking to see if it's a high-risk HPV type. So there are triage guidelines for the abnormal PAPs.
Right, sir. So what is your advice to the upcoming gynecologists in India, sir?
I think that one of our charges, one of the things that is the most important, is for us to catch cancer early and to prevent it from happening, to decrease the burden of cancer in India and in the world. So I would say to the GYN doctors and the gynecologic oncologists is to be vigilant, look for these, listen to your patient, because oftentimes the patient is telling you what the diagnosis is even before you do anything else.
Right, sir. So thank you for your valuable time, sir. It was a pleasure to connect with you, sir. Looking forward to meet you again, sir.
Sure.
Thank you so much.
Thank you.